Okay, so we're doing a few things today. One of the first things that we're going to be doing is using power-assisted liposuction in order to improve the contours of the abdomen. This patient had previous liposuction in order to take fat to graft into the face. And sometimes when that's done, it leaves you with little contour abnormalities or irregularities. That risk is actually high. As high as 1 in 5 patients has a contour irregularity after liposuction. So we're going back in with power-assisted lipo in order to even things out, smooth the contours, and make everything look a lot more natural, athletic, but still feminine. We're adding the tumescent fluid in, and we're separating the fat from what's around it. This gives us a 2-part process in order to get the belly ready for us to take the fat out while adding in the numbing solution. It accelerates the speed of the surgery and makes it much more efficient, but it also makes the fat easier to deal with when we go in for the liposculpture. So the first step in this liposculpture procedure is to define the lines, the line down the middle and the lines down the sides. That's going to improve the contour of what we see. We start in the superficial space to create those deeper lines, okay, in order to kind of etch out or create the natural shapes that the human eye normally sees on the abdomen. These are the hills and valleys that we want to see after surgery. And you can already see through this superficial layer here that we've created this little bit of a dip here, right in between in the midline here. This is what we want to be creating in that superficial layer. Later we go back deeper and we remove kind of in bulk all the fat that's everywhere. We've removed a lot of fat. We've almost got a half a liter. We've used about a liter or so of tumescent to help get in there to get the fat out. We're nearing a stage now where we want to do something called fat equalization. So in a minute I'm going to stop removing the fat and I'm going to start just going back in with the liposuction cannula to spread the fat around that's there to soften any of the little contour irregularities. If you do the separation, then the aspiration, then the fat equalization, that's called SAFE technique. And that's really the gold standard of what we do in liposuction surgery to avoid complications like contour irregularities. So that we have specially shaped cannulas to reach around corners. So this cannula has a slight bend to it, 15 degrees, and allows me to go in and then reach all the way around the corner and get the areas in kind of the love handle region. So you can see as we put the cannula in, we go around the corner and then we're all the way around the edge here, right where we want to be in the love handle region. These cannulas are specially designed to fit and contour the inside of the body, and this is one that I worked on with the company that makes it, to get the curvature just right to reach all the way around the edge.